Okay, it's just now 10 o'clock. I just want to go over a little bit of house cleaning here. First, thank you so much for taking time out of your day to learn about your MyCare plan and the many benefits that it offers. Today, we'll just be going over a high-level overview of the benefits, but more importantly, we want to help you establish your MyWA account and have access to links and valuable information on our website through your member portal. So you're here today to talk about the benefits that are in all of your plans. And joining me today is my colleague, Michelle Lahuda. She's our Director of Government Programs at Western Health Advantage. So Michelle, I'd like to introduce you and you take it away.
Thank you, Denise. I appreciate that welcome. As Denise said, I am Michelle Lahuda, the Government Programs Director here at Western Health Advantage, working with Denise on our Medicare product. So I just want to share a little bit with you today about who is Western Health Advantage. Some of you probably already know that WHA has been a fixture in the Northern California counties that we serve for over 20 years now. We are committed to ensuring our members have access to quality care and flexible choices. We strive to be accessible to our members, and as well, we want to be a community partner through charitable giving. Our care network includes well-known and highly regarded doctors and hospitals, such as our founders, Dignity Health and North Bay Healthcare. WHA is a not-for-profit health maintenance organization, or HMO, as we usually call it. And we are very proud that we give 90% of every premium dollar we collect back to the physicians for patient care. So that's going back for your care too. Next slide. So as a member of Western Health Advantage, you have choices in how you receive care. We give you options from multiple medical groups and doctors. We manage the plan details while letting your doctors manage your care, meaning medical decisions are made by the medical professionals, not an insurance company. And we are proud that each of our medical groups has something unique to offer, and we all work together cohesively to ensure you're receiving quality care. So it's a three-pronged approach. Our members, the health plan, and our medical groups, we like to keep things easy as possible for our members because accessing healthcare should not be difficult. So thank you for this moment to let me share with you a little bit about Western Health Advantage, and now I'm going to hand the baton back to Denise.
Thank you so much, Michelle. Okay, so the first step in getting started with your Western Health Advantage MyCare plan is your ID card. By now, you should have all received your card. Some of you may have received multiple cards. We apologize for that and any confusion it caused. It was just a slight glitch in the system, but we're happy to say everything's working just fine. Your Western Health Advantage ID card, on the front of your card, it should list your name, your provider's name and number, and the medical group, along with your prescription ID information on the far right here. It's important that you know on the back of your card are valuable phone numbers for your provider and your RX and, of course, member service phone number. So part of getting started would be for you to receive your welcome booklet, which many of you have received. Those went out before the end of December. And within that booklet is, again, valuable information and contacts and a little bit of overview on the benefits that are in your plan. It's loaded with information. If you did not receive your welcome booklet, please send us a little chat here in the box and we will go ahead and email you a version of it after the call today. So the first thing you want to do, and this is really important, this is the key to accessing many of your benefits and some of the information you're going to need, is establish your login. Now, if you're a current Western Health Advantage member coming from a group plan or individual, you already have a Western Health login, you will need to create a new one. You'll want to go to mywa.org/MyCare login and create a new login. Right here, you just click on the register, and it'll ask you some simple information, And I think, Michelle, is that active right away, or is it 24 hours? It should be active within 24 hours, I believe.
Correct.
Thank you. So if you already have a primary care physician that's with Western Health Advantage, you've built that relationship, that's terrific. If you haven't, you'll want to establish that relationship with your primary care if they're new to you. But in either case, you definitely want to schedule an appointment with them to update them on your new plan, and in case there's any need to transfer prescriptions or receive new referrals because now you're under the Medicare Advantage plan. You can discuss and schedule appropriate preventive health screenings too. This is important. This is January and they start getting booked up. So you'll want to make sure that one of the first things you do is schedule your health screenings for the year. So we have options, for seeing your doctor. With Western Health Advantage, you can see your doctor in person, but many of the medical groups offer a telehealth service. It's at the same copay as if you were to see your doctor in the office, and you can call your PCP or visit your medical group's website to learn what options are available to you, as the telehealth services may vary from medical group to medical group. But that is an option for you, which is great, especially in today's environment. Excuse me, for urgent care. Now, in addition to the probable telehealth that you have and seeing your PCP, if you have an urgent situation, and you can either call your PCP any time of the day or night, or you can tap into the teledoc services, which is a 24/7 urgent care virtual visit. This would be the same copay as if you walked into an urgent care center. Any questions on that so far? Anybody, do we have any questions? I know we're going to answer them at the end. I just want to make sure if anybody's, there we go. Okay, so our Advantage referral program is unique to Western Health Advantage. Now with the Advantage referral program, you can request from your PCP to see a specialist anywhere in our network, even if they're outside of your medical group. So what that means is that if you're in, say, Hill Physician Medical Group and there's a specialist you need to see for a particular condition or situation in North Bay or Meritage Network, you can request from your PCP. There are some limitations that apply, but that is something that you strictly go through your PCP for, and the health plan stays out of that decision. Okay. Now this is important, transition of care. If you have been receiving care for a chronic condition and you've been seeing a non-participating clinical provider, you may be able to continue seeing that doctor if you meet the transition of care requirements. Now, in order for you to be eligible for non-participating provider care, you must have been treated for one of several qualified conditions. To determine those conditions, call Member Services or download the Transition of Care form, which is available after you've created your login. Go to mywad.org, MyCare, COC. So prescription drug coverage. You have a couple different options for filling your prescription medications. You can go to the many retail pharmacies in our network. You can find those retail pharmacies by going through the directory of network pharmacies, which will include our drive-through and delivery options. Now, pretty much all of the major chains and many of your local hometown pharmacies are in our preferred network. You can also take advantage of cost savings by going through the mail order services. If you have a current mail order service from group or individual, the mail order service is different. We'll get into that in a moment, but you'll want to transfer those prescriptions. And we have two options for you. And also with the specialty pharmacy, Now, depending on your condition, depending on the type of medication, and if it's self-administered or has to be administered by your doctor, if you are on specialty medication, that can be delivered to your home or straight to your doctor's office. So the mail order prescription, the prescription mail order services are through PPS RX, which is Postal Prescription Services. Their phone number is listed here. It's also in the welcome kit, and it's also available on the member portal. Costco mail order is the second option, and the really great news here is you don't even have to be a member of Costco to use the mail order service. Our specialty pharmacy is through Credina Health, and they are very good at helping you coordinate your receiving your medications and transferring your current specialty prescription, if you have one, from your service that you're using now to the new one through Credina Health. They're very good at that. Just give them a call and they'll walk you through the whole process. So behavioral health. Now we have partnered with Magellan, and we actually are going to be having a whole presentation and going through, what's available through the Magellan services. And I believe that's on January 26th. So for all of these benefits, we get into the nitty-gritty details for you on some separate webinars. So make sure you check the calendar and sign up for these. But there is no PCP referral required to utilize the Magellan Healthcare. And you can find the providers in the Magellan network by clicking on the link on the MyWA website. So after you've logged in, there's links to all of these services and a link to the provider list for the behavioral health. So benefits and extras. There's a lot of benefits and extras that extend beyond your benefits in your plan. So with Western Health Advantage plans, we're going to go over a little bit about your quarterly over-the-counter benefit. This is for things that are non-prescription that you would purchase, say, at a drugstore or pharmacy. The behavioral health services, wellness benefits, which include your Silver and Fit fitness program, and alternative care, such as acupuncture and chiropractic, routine services, and this is a benefit beyond what Medicare covers. So global emergency assistance in addition to your worldwide coverage, and your annual eye exam plus eyewear allowance. So the first thing is your over-the-counter benefit. We have partnered with First Line Essentials, and we're really excited to say they're going to do a presentation on how to log in, order your products, and have it delivered to your home. That's on Thursday, the 14th, so make sure you sign up for that. There's going to be a separate login for it, but again, you can get to the First Essentials website through a link on our website. Each one of you have a quarterly benefit. It's either $50 or $100, depending on the plan you enrolled in, and it's very easy. You can order things like toothpaste, vitamins, Band-Aids, and so much more. Do it from the comfort of your own home, and your orders can be placed via phone or online, and are guaranteed delivery at no shipping charge within, I believe it's 24 to 48 hours, right to your porch. Our fitness program is Silver and Fit, and what's wonderful about this program is it's tailored specifically to your unique needs. You get to drive your fitness program. So if you choose to go when they're open to the gym, we have a wide variety of participating gyms that accept the Silver and Fit, but you also have access to digital workouts, videos, home equipment like Pilates equipment. You'll go over that with your Silver and Fit counselor, and based on whatever you need, we can deliver those fitness kits to your home, and you also have access to the gyms throughout our service areas. So the value-added health and wellness program, this is wonderful too. This is available to all of our members. This program helps you, set and achieve your goals Everything is done through a portal at our which is the central hub for all of the wellness programs. But it gives you tools to track your achievements, track your progress. And I believe if you are already utilizing the wellness program, any progress reports or things you have going on will carry over. Michelle, correct me if I'm wrong, but I'm pretty sure that's the case. These benefits are available through Optum, and again, they are for all of our Medicare individual or group members. If you're a member of WA, you're a member of the wellness program. So alternative medicine. Now, you do not need a PCP referral for this as well. You can choose alternative medicine through acupuncture or chiropractic. We have partnered with Landmark Health Plan, and they provide our members with an abundance of wellness services. So you can take care of your back pain, your headaches, much more, all through acupuncture or chiropractic. Or let's face it, these days, we all have a little bit more stress, and so these acupuncture and chiropractic are very, very effective in helping you reduce stress as well. Now we have our travel assistance. As I said, over and above the worldwide coverage, we have Assist America. It's important to understand this is unique to and exclusive to Western Health. And with the Assist America, if you travel as much as 100 miles away from home, so that'd be just going to Southern California, and in some cases up to Reading, you have additional benefits available to you. If you forgot your prescriptions or you lost your prescriptions, they can help you fill them. If you need to see a doctor, they'll help you find a provider in the area, help you get, hotel accommodations if you have a need for that. Even if you lose luggage, they'll help you replace it. But even beyond that, if you travel internationally, whenever we can start doing that as well, they'll help you find, maps, restaurants, maps to locations, restaurants. They've got a great, easy to use app that anything you need, you just, type in there, and if the service is available through Assist America, they will be able to get to you right away. Even if for some reason you needed to find the consulate, the nearest consulate, to replace a passport if you lost it. It's a very valuable value-added benefit, and again, exclusive to Western Health Advantage. People who use this and download the app and use it on the mobile devices find quite a bit of value through this. So I hope you take advantage of this. And I mentioned vision care. Of course, you'll get your eye exam through your medical group, but if you were to receive a prescription for glasses or contact lens, you'll take that prescription. You can fill it at your medical group with no problem, but you might also want to, stretch your dollars for the credit that you receive for the eyewear and go to someplace like Stanton Eyewear or Lens Crafters, Target, anyone that is part of the MES network. You can fill your prescriptions. You can go outside of your medical group. For your eye exam, there's no need for a PCP referral for this as well. So there's an abundance of benefits. You don't need to get a referral. Just check, and the vision exam is one of them. So with that being said, if anybody has any questions on these benefits, please go ahead and type a question in the panel, in the chat box over here. And we'll go ahead and get to it. We're going to get to that in just a moment, but I want to reiterate, I'm going to go over some dates with you. Thursday on January 14th, please register for the over-the-counter benefit seminar. That's our vendors joining us, and they're going to go over everything you need to know on how to get the most out of your over-the-counter benefits. On January 19th, we're going to be hearing from our Silver and Fit representative. They're going to go over all the different programs. There's so much that is available to you through the Silver and Fit. I couldn't possibly fit it into just this one meeting. So it would be great to go to that one as well. And then again, on January 21st, make sure you register and check out the chiropractic and acupuncture overview. They're going to go into more detail on the eyewear benefit. On January 26th, we are excited that we have a guest speaker, for our mental health from Magellan Health. And Lisa, feel free to chime in and give us the name of the person that's going to be conducting that. No? Okay.
No, hello. Hi,
is.
everybody. Sorry, I had to get it off mute. Stephanie Parmalee, PhD. She's a psychologist with Mercy Medical Group in the Sacramento area, and she has great tips, really practical tips, and she's fabulous and has done a lot of interviews and webinars and events to help people.
That's great. Thank you, Lisa. So don't miss that. That's on the 26th. On January 28th, we have our fitness and health support with MyWa Wellness. We'll have an overview on the entire wellness program. And then on February 2nd, how to, assessing your care with your PCP and other specialists. And then February 4th, we'll be doing basically a summary recap of all of this. So let's get to some questions here. Let's see. Raymond, maybe, I think you've answered some. Let's see. We have one here. People can call it.
Denise, there's a question
Yes.
about the copay for acupuncture and chiropractic visits.
Oh, that's okay. Well, it depends on which plan you're on, but with the MyCare plan, the chiropractic and acupuncture copay is $20 for either plan, actually. And I'm sorry, what was the other one?
No, that was it. And there's only question so far. Oh, wait, sorry, there is one more. This was someone wanting to join Zoom and see the panel. So maybe you could talk about the...
Do what?
Maybe they don't have the link. Maybe they don't have the link. I'm not sure. Maybe we can answer that one in a reply in the chat on instructions for that.
Okay. Okay. And somebody said...
Just to clarify the copay for acu and chiropractic, Denise is correct. It's $20 for either the MyCare or MyCare Plus. It is a combined benefit of up to 10 visits on MyCare and a combined visit of up to 20 visits on the MyCare Plus.
Yes. Okay. So I've had a couple requests for the booklet, which I will email you. Let's see, we're going to email to whatever email you registered with. So if it's different, please put that in the box. Let's see, so we'll email you. That's the acupuncture, another question about that. So same question. Let's see, copay, chiropractic visits, we have that. A lot of interest in the chiro. So, okay. All right, we're going to check with that. So some of these have already been answered.
And there is a question about setting up the MyWa account.
Yes.
Setting up a MyWa account is for you as a member. It is separate from your broker agent relationship. So this is your account with Western Health Advantage, your member portal account, so you have access online to your benefits. So yes, we would still encourage you to open that member portal account just so you have the benefits at your fingertips online.
Okay. So looks like somebody was having trouble creating an account with First Line Essentials as well.
I addressed that.
Oh, you did? Okay, thank you. All right. And any I didn't catch here. See, do we set up a separate MyWa? Yes. Yes, you do set up a separate MyWa account if you already have one, especially if you're an agent. This is a different, it's strictly for the Medicare. Okay. All right. Pretty sure we've captured everything, but if there's anything we missed, we will email you directly. We're going to download all these questions, make sure we answered everybody, and you can always give us a call at our member service phone number, which is 888-563-2250. And let's see, what is the copay? Okay, we've got that already. Oh, okay. So you're going to, we'll answer this other one after. So thank you so much for taking time out. And if you joined Western Health Advantage through a broker or agent, make sure you reach out to them. If you have additional questions, you can call us direct, member services. And more importantly, as Michelle said, it's real important that you go ahead and establish your MyWA account, start scheduling your health screenings, and establish your, if applicable, your new patient visit with your doctor. Now, it's real important. I want to explain that if you are waiting for your introductory meeting with your PCP, but something comes up and you're sick and you just need to see somebody right away, the medical group can get you in sooner. A lot of these new patient meetings are, put out for a week or two, maybe 3. But if there's a situation where you need to get in to see the doctor, maybe have a prescription refilled that's running out from your old plan, you can definitely call the medical group, call that doctor's office, and they will get you in to see somebody.
And Denise, there was a question about accessing specialists. So if you if you are a member, not a member, if you were a patient of a WHA participating provider prior to joining Western Health Advantage with another health plan, then any specialty referrals you have in place under that other health plan do need to be reestablished through Western Health Advantage. But it's fairly simple. The next time you just call your primary care and let them know that you need to now have your specialty referrals established under Western Health Advantage, or the next time you see your primary care physician before the need to see the specialist, just let them know and they can get that going for you. Now, if you were coming off of a Western Health Advantage commercial product, whether it was an individual and family plan or an employer group plan, and you're transitioning to our MyCare plan, you do not need to do that. It's only if you're coming from a different health plan to Western Health Advantage with the same provider.
Right.
Thank
you, Michelle. Yeah, it does. So we have another question here. If you have a referral to see a specialist prior to joining the Western Health Advantage plan, do you need a new referral? The answer is yes. So even if it's the same doctor, same PCP, it's a new plan for you. So you will need to get a new referral established with your PCP to see that specialist through your MyCare plan. I think so. Okay, we'll expect an email from us directly after this. For those of you who have requested the welcome catalog in email PDF, I'm going to be sending that to you. If there's anything else you need, feel free to give us a call. Again, the member service number is 888-563-2250. It's right here on your screen. And thank you so much for joining us. You have a wonderful day, and we look forward to seeing you on our future webinars. Make sure you sign up today. Thanks, everyone.